So, are there laser treatments for neuromas? Actually, there are two types of laser treatments available. One is non-surgical and the other one surgical. So the non-surgical is using what's called the MLS laser. This is a dual wavelength laser using 808 nanometers and 909 nanometers as wavelengths. So the 909 nanometer wavelength decreases the inflammation around the nerve, and the 808 nanometer wavelength works on the pain receptors. So the two come out in unison, working on pain and swelling. Now, the success rate with that, again, can be better than 80%. But when patients fail with that, and they have failed cortisone injections and orthotics and changes in shoe gear, then we can use a laser in surgery. Now, that laser is called the CO2 laser, and the CO2 laser is very, very hot, and so can only be used under anesthesia. So we use that laser to precisely cut the nerve branches, and at the same time, it seals off the end of the nerve so that it decreases the chance of developing what's called a stump neuroma. If you cut a nerve with cold steel, a surgical blade, you may have a kind of a frayed end, much like if you cut the end of a rope. And there's a propensity, about 20% chance, of developing another neuroma. So that even though it's not connected to the nerves that go to the toe anymore, if you develop one of these, the brain is so programmed to know that that's where it went, that if you irritate it, you're going to feel pain there, much like phantom pain when somebody's missing a limb and it's itching or it's painful. Now the CO2 laser will seal it off, very much like taking a glass dowel and putting it over a Bunsen burner and then just rounding it off and sealing it. So that decreases the chance of a stump neuroma significantly.